All right, let's bring in our guests now on this issue. We have Dr. Nihar Parekh, a pediatrician and director of the Cheers Childcare with us. And also joining us is Poonam Mathreja. She's executive director for Population Foundation of India. Thank you both for joining us. Dr. Parekh, let me give you the first word. Obesity among school children from 5 to 19 has tripled. It was 3%, it's gone to 9.4% in just a matter of 20 years. Now, before I get into the causes, do you think parents in India or people in general even understand what an obese kid is? Or we are still calling it khate peete ghar ka bachcha?
So I think there is a shift of mindset of parents now of school going children. But the shift comes because they get complaints from school where the child is not, being able to cope up with the day-to-day activities. The child is not able to perform in sports, indoors and outdoors. And then the parents, when it comes to peer pressure, bring down the entire thing to the weight of the child, forgetting that they were the primary cause who led to this. So yes, there is tremendous amount of awareness. There's a lot of data available. Plus, but I still feel the driving force today for a parent to change their mindset from a khate pite garka to a worrisome obese child is peer pressure and the inability of the child to compete and match the peers.
Compete and match the peers. That's interesting. Poonam Mathreja, what do you think about that?
So, while in India, the new warning by UNICEF is resonates, but in India, the challenge is different from what we see in the problems that, because in India, the problem is coexisting obesity along with malnutrition and undernutrition. Look at India, where 36% of the children are stunted as per NFHS 5, 19% children are wasted, 8% of children are severely wasted. And at the same time, overweight is sure rising. Overweight amongst young people is, I believe, more a middle class phenomena and urban cities than in rural areas. And it is with people's incomes going up, where they not only overfeed the kids, but they purchase junk food, which they are not aware. I believe they're not totally aware what junk food does. And secondly, let's remember in India, we already have a problem where so much of our food is unhealthy. I heard government was going to put warnings on samosas and jalebis. Happen. But we have very high fattening food in India, and that's why diabetes, and we consume a lot of sugar, we consume a lot of carbohydrates, which help. And most worrying is that this is a phenomena. We also have 57% women in India who are anemic, 67% children are anemic, and women in girls are
Ma'am, you bring up very important points from an India perspective, which is why I want to bring in those India figures again. And Dr. Parekh, come in on this one. The overweight percentage or obese percentage is gradually rising with the years. You see 1.6% from 0 to 4 goes up to 4.8% by 10 to 19. Typically the teenage years, right? Typically the time where the kid is beginning to tell parents, listen, I know what I want to have. Typically the time when kids are telling parents, aap bhi to khate hain, or everybody has it. So is that something that we need to watch out for?
That's actually the root cause. So the food culture comes a lot with gratification, and gratification becomes an integral part of a child's behavior mindset, where the child is looking to feel happy all the time. The parents are busy. Parents are looking for a quick fix to keep the child happy so the child doesn't hamper their daily schedule. Now, this entire thing comes also hand in glove with a tremendous amount of marketing strategies used by food that looks so good and is so hard to resist. When it comes to apps and phones, increased screen time is number two. Kids feel 3 times more hungry in front of a screen than when sitting on a table. Quick delivery apps where, as the children grow and have access to phones, by simply a press of a button, there is food delivered of their choice within 10 minutes, whether it's 2 in the morning or at 3 in the afternoon. So all these things put together, leading to only one thing, is I want to be happy as a child. I want this as a child. And when the parents stop them, the first finger is pointed towards the parents, rightly so, that if you're doing it, if you're eating in front of the screen, if you're ordering in the middle of the night, why can't I? So I think the parents need to first practice what they preach.
Yeah. So many questions come to mind, but I just want to quickly give the last word to Poonam Mutreja as well. Ma'am, you're right that India has a dual problem. But I think it's also come with the rise of the middle class. I think there's a generation, and my heart goes out to parents who are thinking that, I did not have this comfort, and which is why I want to provide it to my kid. Or perhaps, and they don't understand that their way of growing up, the food they ate, or even the entire day's routine that they have is drastically different from what kids have today. How do we get that mindset shift? Because I don't think any parent wants to harm their kid deliberately, right? It's just that they are not aware. How do we bring that awareness?
You need awareness campaigns. We need awareness campaigns that are persuasive, not icy. We need entertainment education. We need changing social norms around what is good for the child in terms of health. We have a broken food system, I'd like to say. Lack of affordable, diverse, micronutrient foods.
Absolutely.
We need to promote the market. We cannot, strengthening the Poshan 2.0 Abhiyan. We need very different food. We cannot give them so much carbs. And, we have to go back to coarse cereals and diets. Even look at our ration. We give rice and wheat. Let's start giving some healthy, rough, traditional
whole wheats.
to eat. But
Whole
it
grains.
has to be like an abhiyan. It has to be in a mission mode. And at the highest level, political leadership, but also the diets are shaped by what we shop. So we have to shape our broken system, which includes what is available.
I'm so glad you brought that up, ma'am, because this problem, the problem of obesity, not just in adults, but even in kids, cannot be solved by one doctor. It needs systemic changes. It needs the government to step in. Yes, I am a mom. I have stopped eating sugar because I don't allow my kid to have it, but I'm not sure how many parents actually manage that. And that's why you're right that there needs to be government reform. There needs to be government awakening. The latest GST figures were encouraging. We need more of that. We need cut down on oil. We need cut down on packaged food altogether. And we need labels which tell us just the amount of absolute chemical that we are putting into our body. So thank you both for joining us. Like I said, it needs both. We need solutions in the kitchen, but we also need solutions coming out of the parliament if we really want to fight obesity in the long run.